guys, I'm Dan.
I'm Fran.
And we are back with the No Shame OBGYN Podcast. And today's super sick talk is what I would say is all about birth control.
Protection from pregnancy.
That's the goal. And, we're going to discuss a lot of things today in simple terms, right? Like we always say, you always talk to your doctor about the details, but we're going to talk about a lot of options that are available for you to try to get you to the point that you're not wanting to have kids.
Yep.
That's the goal with this. And some of these birth controls, believe it or not, are also good for medical things, which we'll hit on those things too, right?
Yep.
So let's start.
Yeah,
right?
for sure.
So Fran will give you some experiences, and I will give you some fun facts that's just data proven. And then we also know there's a lot of stuff in between, right?
Yeah.
So we'll talk about those. So let's talk about some flavors of birth control, but I kind of want to start with the story.
I thought you were going to start with flavors of condoms, and I was going to be like, whoa, that's a different one.
Do they come in flavors?
Yes, are you kidding? Yes, they do. You can get like banana flavored,
For
strawberry flavored for fun, Dan. What the fuck? Listen, the whole point is to get people to use them.
That old?
I mean, you haven't used them in a long time, I guess.
Used them in a long time.
I know for a fact that these things come in flavors and textures and things to keep people using them. So like kudos to the condom industry for keeping it fresh.
Oh, business is business.
Business is business, but it also keeps us in business.
Well, one way or the other.
One way or the other.
One way or the other.
But yes, So other than condoms, today we're going to focus more on the female-centered contraceptive methods. So, Dan, what were you going to say? You said.
Yeah, so I mean, let's talk about some stories, right? Because I always have a lot of patients coming in, whether they're the 16, 17-year-olds that might be starting to become sexually active, or their parents are like, hey, can you just give her the option so she knows where she would go and not like to a random place, so that way she finds a good relationship with her provider, right? Yeah. So that's one story. And then we have like the 20-year-olds, the 30-year-olds that might be in relationships that aren't just ready yet, or have had kids and they just don't want to have them again. Because after that postpartum episode, I'm pretty sure we've influenced a couple people for some of these birth control methods, right?
His inbox went wild with requests for their birth control pills after we talked about how wonderful postpartum is.
Amazingly wonderful.
So fun.
Great. All right, so let's start with the pill, right? I think that's the most common one.
Yeah.
That's the most common one that just people know about.
For sure.
Right? I'm sure you have friends that, let's say younger in high school, like that they talked about the pill. That's just what it's known as.
I myself had the pill from when I was like 16 on. I mean, I was on it for like a decade.
Yeah. Yeah, and it's a great option, right? They have some contraindications, but there's two types of pills. Let's just put it simply. There's one with estrogen and then one without estrogen. Both have progesterone, right? So those are like the pill forms.
Okay. Well, let's break it down even more for people maybe that are watching this that shouldn't be because they're under 18. But what is estrogen and progesterone? Like, what does that mean to you?
Well, from the doctor perspective.
Yeah, how would you explain to your patients what that is?
These are your two glorious hormones that make you who you are in the sense of what you experience, that influences your emotions, that influences your periods, that influences your attitude. Those are the main hormones of the female kind of body. And those two influence, one, your ovaries, but also your uterus. And those are the two things that we can use to either prevent your ovaries from helping you get pregnant or your uterus from affecting your uterus so it doesn't help you get pregnant, right? So those are the two ways that those two hormones can interact with your female reproductive system.
Yeah. What is it like to be a man that doesn't have hormone changes? Like I was thinking about this the other day. What's it like to just wake up and just have the same brain that you did yesterday?
It's sick. You wake up 5 minutes before you have to leave the house, brush your teeth, put a little water in your hair, and you're up.
Yeah. Because, for me, I was talking to somebody about this the other day. Like, it must be great to be a dude because you're just, you're the same. You're stable the whole month. Meanwhile, the other day, I, wanted to rip someone's head off because my shoelaces wouldn't tie correctly. And then I got my period, and I was like, oh, I get it now. That luteal phase is a bitch. No, it really wasn't. I was totally sober. It's just that luteal phase, and she's getting a lot of press right now on social media.
And then you'll see a lot of convoluted videos online about how your estrogen goes and your progesterone goes, where it is in a cycle. And the pill kind of tries to help regulate that. So if you have certain conditions that are affected by your period or ovulation, kind of like headaches, mood changes, things like that, the birth control pill actually can be a great useful tool, not just to help you not get pregnant, but also to help regulate a couple of those things.
But what about patients who get migraines? I hear this one a lot, that if they get migraines, they should not take the pill.
Big misconception. People that get headaches, not everyone, but majority of people have headaches, right? Then there's the next level of migraines, and then there's another level that's really what matters, and it's migraines with aura. Okay, and the aura has a certain criteria of definition that multiple bodies use, like the neurology and as well as some fancy groups. And based off of that, you see whether or not you truly have a migraine with aura. So just because you walk into a room and the light bothers you, it does not mean you have a migraine with aura and therefore cannot have the birth control pill. There are conditions that we say pill is not for you, meaning the one with estrogen and progesterone. And one of those is the migraine with aura. Okay. One of those is also, the most common one that you might hear is if you're over the age of 35 and you smoke more than 15 cigarettes a day. So that's a solid no. And the reason is...
But 14 is good?
14 is great, right. And we just mentioned 2 of them, but there's no point to going into the details because these are specific discussions you got to have with your providers. But the big ones is smoking over the age of 35 and a certain amount of cigarettes. And the other one... the migraines with aura.
Okay.
Right. But there's other things that are there as well. But those are the things, again, you go to the doctor and be like, hey, I want to be on birth control. They're going to ask you, well, what's your medical history?
Right.
And those are the things we need to discuss.
Okay. So if someone's not a pill taker, they don't like to do pills, what are the other options for your birth control? Yeah.
I'm actually going to put this on the screen when you guys watch this episode, but there's great charts not just by the CDC, but also by a lot of different organizations of just the different types and how effective they are. And they're just pictures, right? And look at these pictures, see what it is, and just ask your providers about all of them and be like, is this one right for me? Is this one right for me? Does this one sound crazy to take? Because some of them are kind of crazy for you to take in certain situations. But look at that table because it's very interesting to see at least what's out there because you might not even know what's out there.
What's your favorite?
I think the one that I give the most in the office, prescribe, is the pill. And the one that I administer the most is the IUD.
Which one? Which IUD? There's 2, right?
Well, there's 2 different types.
Actually, there's
like a bunch. But the ones to mainly break it down for you guys is there's one with hormone and one without hormone. And a lot of people get kind of just like, whoa, hormone, or like, holy hell, I'm gonna have hormones in me. But a fun fact is, for example, the Mirena, which is the most common one with the hormone that we give. That is put into your uterus, okay? And that can stay in for 8 years, and you don't have to take something every single day.
It used to be 5, right?
It used to be 5, now it's 8.
Wow, nice.
And the other awesome part about it is if you think about taking a pill, so some data shows that the amount of progesterone that goes into your body from taking the pill is 10 times more than the progesterone that goes into your body than taking the IUD. And the cool thing with the IUD is that it's mainly local and it affects the uterus locally and prevents you from getting pregnant, and it's actually more effective than the pill too.
Yeah.
There's no user error, like you put it in and it kind of stays in there.
Well, assuming it's put in the right place, right?
You mean the ones that go to like the heart and lungs and
No,
brain?
It doesn't go to the heart and lungs. However, there are instances where, depending on, if it just, anatomy, user error, it's not impossible for it to migrate or just be placed in the wrong spot. And sometimes, my sister-in-law had it up in her omentum, and the fat around her intestines. She had to have surgery to get it out.
Damn.
Yeah, sucks. She was like, I'm not getting pregnant, but I don't feel any strings anymore.
Fun fact.
And they did an x-ray and it was up in yonder.
Fun fact, if that's the Mirena IUD, technically it's still working.
Yeah, it did work. She didn't get pregnant.
But that's like, okay.
But it's very rare.
That's,
super rare.
So what we do in the office, just so people are aware, is that once we put it in, we do a sonogram then and there to say, hey, it is in the uterus.
Yes.
And then you come back in 6 weeks and we say, hey, look, it's still in the uterus.
Yes.
And by that point, it's not moving anywhere.
Correct.
Some, especially a while ago, they didn't do sonograms a lot as often. They just put them in, which is fine too. The data shows you could definitely do so. But you just do the sonograms, take a look at the strings, make sure they're in place. And I actually have a sample for you. Give me 1 second.
Yes. While he's gone getting that, I'll tell you that another fun perk of the Mirena, because I love a Mirena, I have one in me right now. A fun perk is that 60% of patients will not get a period anymore. And we all know, or maybe we don't, but we should, that you don't have to have a period when you're on birth control because you're not actively ovulating anymore, right? We're preventing ovulation, right, with that estrogen and progesterone or whatever hormones. And so periods are unnecessary. They're just withdrawal bleeds when your hormones are pulled away, when we stop giving you them.
Correct. So this is actually a copper IUD.
Tiny. Look how small. This is the copper guy. So there's no hormones at all with this bad boy, which is really good for people that are terribly afraid of hormones or have medical issues that
They can't have
make them that they can't have hormones. But this guy is really small. And believe it or not, your uterus is that freaking small that it sits and takes the whole shape of it, right?
The whole size of your uterus, on average, is like 7 to 8 centimeters, the whole thing.
For the American crowd, that's what, 3 inches, 4 inches?
3.5, 4 inches?
Not a guy. A woman's 3 inches. Yeah. Anywho's. So these are the strings. So another very common complaint from the gentlemen out there is that like, ooh, I feel the strings when we're having sex. You know, here's the thing. You might. If these guys are cut, like, let's say right here, and so
they're sticking straight
out, they might actually poke him. That is not fake news. Most of the time, however, we leave this nice little tail so that A, you can go in there if you're not queasy about your vagina, which you shouldn't because you own that. That's yours. But you can feel the strings and know it's in the right place.
Right.
And they're so soft that it shouldn't poke or bother anyone.
Yeah.
Now, when you place it, real talk, it hurts. And I don't give a shit who you are, it still hurts.
I'm gonna be honest. There's some people that like feel nothing. But that's the rarer side of things. I'm just gonna put that out there.
I've had 2 of these placed, and I've had 3 babies. I'll tell you, it's not agony, but it hurts. Like, it's not pleasant. So, you know, what happens is you put the speculum inside. You look at the cervix. We take a little plastic tool that's called a sounder. We just measure how deep your uterus goes. And
because we're very nice to women, we also give some nice lidocaine injections into the cervix.
Do you always though?
I do.
Okay, so that's wonderful. So not everyone does. You can ask for this.
And also some
Numbing.
offices now have nitrous, which is laughing gas. Gets you like really drunk and feeling great.
So lovely. And it's immediately gone, so you don't have to worry about driving home afterward. So the idea is once we sound your uterus, we call it, some providers will use what's called a tenaculum. So it looks like a sharp like tooth clamp. And that pinches. It feels like a pinch in a weird spot. So they grab the cervix to keep your uterus nice and straight. And then you
it's a motion.
Yeah,
in
just peep and out. And then she's in. And then the thing is, it's uncomfortable. It's maybe not your favorite 30 seconds of your life, but that's 30 seconds that covers you for 8 to 10 years, depending on what IUD you get. Yeah. So it's kind of like, all right, can I suck it up and deal with it for a little bit?
And we're never forcing this down anyone's throat, right? It's what's best for you, and this is an option. And there are times where I've had younger patients who, let's say, are going off to college and they just cannot do pain, where we give them light sedation and in the OR and put it in because, again, you're taking the pros and cons of every situation, and you deserve to have access to birth control. And 100%. We're in a place where we can offer that. Yep. So then, let's offer that and do that because that's fantastic.
Now, let's just say you actually plan on having kids in the near future, in the next less than 8 years. That's not a good choice for you, right? Necessarily.
Right.
Because then you got to pull it out. And it's a waste of your time, waste of your money, waste of your discomfort. So there are other things like your Nexplanon, which is the brand name for the injectable, the rod insert in your arm. That lasts, how many? 3 years?
But I think they're making it 5 as well.
So that might be something,
it is 5 already.
If you're like 3 to 5 years that you're interested in.
Can I give you a good story?
Yes.
I got a good story.
Oh, God, me too, actually. But you go first.
Okay, so I place them in the office, but I also take them out in the office. And I had a patient come from Brazil, and she's like, I have the Nexplanon. I'm like, okay, great. And she's like, I want it out. I want to have babies. Okay, whatever. Who cares? So I go in there and I do an incision. Right.
Where?
So it goes right here, it's like there's a distance, but whatever. It was sitting right there, and they do a tiny little incision right here with lidocaine. So you're a nice human being. So the lidocaine, if anything, hurts more than anything else. And then you kind of like try to push it out and feed it out. So I'm feeding it out. I get the Nexplanon out. I'm like, great, we're done. And she's like, no. I'm like, excuse me. I'm like, yeah. I'm like,
it's out. I'm holding it.
She's like, no, I have 2.
What?
I'm like, 2. And then I go down this rabbit hole, and my partners said there used to be one with 5. There used to be one, like there's many different types. So it's actually very interesting to see the type of things that are also not just in this country, but around the world.
Wow.
Yeah.
That's wild, dude.
It's crazy, yeah. So I took that down and I went digging for another one, and it's just shorter, but they all do the same stuff.
Yeah. So similarly, I had a friend who came from California. She had her next one placed in Cali. She relocated here to be with the love of her life. Good for her. But she wanted to take it out because it hit her expiration date.
Right.
And she said that when she called a couple doctors, they were like, nah, I didn't put it in. I'm not taking it out. Which...
No, we do hear that a lot. But as, you know, the thing is also we're in a place that we don't normally, like the arm.
Right.
But, you know, this is form of birth control. Like, it should be an option for people to like, get placed, but then also to get removed. So, like, that's our responsibility.
I think, to be fair, this was when this kind of first came onto the market and people weren't super duper comfortable.
This is not going into your bone, into your veins.
It's right under the skin.
Like, if you ever had, like, that tuberculosis shot where it, like, gets inflamed a little bit, it's literally just sitting right under the skin. So it's not as crazy, and it's also not directly in the uterus. For some people who are like just squeamish of everything down there and they don't want anyone going down there, it's actually a pretty good option.
I'm more anyway. So let me get back to the story.
Okay.
So she comes to my job. I have a couple doctors around. I take a circumcision kit because it has some stuff I want from there, and I make a little incision on her arm, and it's like right under her skin. I could feel it. It's actually a little bit. It made me queasy that it was so close to the skin. I could like
you could feel it.
Anywho, I start trying to dig this bad boy out. I couldn't. I dug so hard and deep that she was like bleeding. I had to call an attending to help me, even though what I was doing was like not on the up and up. We pulled it out. I had to throw a stitch in her.
Yeah. And then some people have to go to the OR to get it taken out.
First of all, anything that requires that much intervention, not my favorite.
Yeah, but then again, you also just told us a story about whoever it was in your family.
Right, again, we're giving you guys stories for entertaining purposes. This is unusual, but I will say, like, this is why you have to get full informed consent, because you have to know that, like, you're going to have to get it literally cut out. Yeah.
But, you know, interestingly enough, that Nexplanon thing is actually more effective than getting your tubes taken out.
Because people can't get it out after? I'm just kidding. I'm just kidding. But that's good to know.
That's just a fun fact. I got a good myth that I always get, and then that we always have to explain, is that if I get an IUD, I'm more likely to have an ectopic pregnancy.
Ooh, that's a good one.
Have you ever heard of that? Because that's what...
I don't think that's true, but
It's not true.
Right, I don't think that's true.
So if you were going to think about this, the likelihood of you getting pregnant with an IUD, right, is already 0.7, whatever it is, that you're not going to get pregnant.
Right.
So it's very effective.
So 0.3% of patients might get pregnant.
But out of those 0.3% of patients, if you fall into that category, then you actually have a higher chance of having an ectopic. That's what it's saying. Okay. But the overall chance of you getting pregnant, period, is so unlikely.
Yeah.
So what you see, they'll give you the first sentence of anything because it's a seller, but you need to get in context of the whole situation.
I saw a picture of like a baby holding an IUD, and people believe that shit like was born with the baby. I'm like, yo.
It was.
No, it was not.
Yes, it was. So I'll give you this. There was a debate in the OBGYN world that, let's say you get pregnant with an IUD in place.
So you leave it.
Well, for some time you had to take it out because it was a foreign body.
Oh, really? I thought we left it.
And now we leave it.
Oh, okay.
So it was like a back and forth discussion because, you know, if it's a wanted pregnancy, that's what do we do? Because if you pull it out, you risk disrupting something and causing a miscarriage. If you keep it in, it's a foreign body and could also technically cause a miscarriage. So, but your next form of contraception probably should not be the IUD.
Word.
Actually, the person I just did a salpingectomy on last week.
What's a salpingectomy?
So a permanent form of contraception is when we take out both tubes. And for many years, they actually used to just tie them and leave them in. But then there was some data coming out that removing them has some benefit for decreasing your ovarian cancer risk.
Ovarian cancer
risk. So they said, you know what, instead of just tying them, let's actually take them out. And also it's more effective than just tying them too. So a lot of the times, especially during C-sections, right?
Yeah.
Like when we're already there, we always ask them like, hey, you sure you want more kids or whatever it is? So this is something that we can provide for you during the C-section.
Yep.
And a lot of people ask like, oh my God, it's a massive surgery. Is this going to add so much time? Is it safe? And if everything is normal and okay, it adds like what, 3 minutes?
Yeah, literally.
It's nothing.
You're nuts.
Yeah, we take out an extra instrument, but it's other than that, it's not a debacle for us to do.
No.
But if it's unsafe to do during the C-section, we're not going to do it.
Yeah.
We're just not going to do it.
Yeah.
So it's a great option too. But whatever, this patient that I did a self-injectomy on last week, she just had her 4th with our practice, and she got pregnant with the ID.
Oh. That's like some Jurassic Park shit, like life finds a way, you know?
Yeah.
Like,
and she's happy and she loves the kiddo and she's like, but like I am done. I'm like,
yeah,
no.
I know, she's done.
Again, after that postpartum episode,
Done.
we understand.
So there's some other things too. So yeah, so tying your tubes is a final, right? Taking your tubes out is uber duper final, although there have been very, very rare weird cases where if someone doesn't take the entire tube out, although they thought they did, you get like a little surprise ectopic because it's not likely to go into the uterus. But I digress. But we also do have the patch, which you just slap onto yourself.
Oh, I got another thing.
Oh, what else do you have? We also have the ring.
The ring.
So
there's 2 different kinds of ring.
Yeah, so there are 2 different kinds of rings.
This is the one that you could technically use for a long time.
Yeah, so one of them is, okay, so this is the thicker, bigger guy. And just for reference, so it's about fits in the palm of my hand. So this guy you don't have to take out often.
Well, this is one you can reuse.
Oh,
that's the thing. This
error.
is the one that you can reuse.
Error, ignore me.
Yeah.
So this, for my ladies who are daunted by placing these, it's really not that serious. It's really soft, moldable plastic. You just like it when you learn to put in a tampon, if you did that, you kind of sit over, I wouldn't sit over the toilet necessarily because that's how you drop it into said toilet. But if you close the toilet bowl, you sit on a toilet edge, you move your leg. Thanks. You put one leg up on something. You kind of sit like yay. You could put a mirror on the floor to help you see your anatomy if you don't go by feel. No, this is I'm just trying to like kind of make this very easy for the crowd here. And then you squeeze it together. You separate your labia and you place this into your introitus, which is your vaginal opening. That's the mirror. And then it slides up in there. Now, this guy's a little thicker, so I have not had the pleasure of using this, so I don't know what it feels like necessarily, but I have
And to everyone is different.
Right, I have used the other one, the skinnier,
thinner and
3-week long, and then you replace it, commonly called the NuvaRing. It's much thinner than this, to be honest, but it is a little firmer, which is interesting. But yeah, same way, you kind of compress it, you slide it in, and then you do not take it out for sex or for anything. I had a girlfriend that took it out for sex and she had a baby. So you don't take it out. Gentlemen or gentle ladies don't feel it when they're up in there. Only you know it's there. I mean, they might feel it with their hands.
I feel like you've gotta feel this though.
You feel it with your hands, but not with your penis.
I'm like wondering this one.
I mean, honestly though, if it like tucks up around your cervix or behind the posterior part of your vagina fornix, you probably won't.
No, I don't know. I've actually, funny enough, I've never prescribed this.
Yeah, that's a jalopy, dude. I don't know. That's a
big. And listen, to each their own. And for some people, like it's like they don't have to go pick up a prescription, and it just always stays there.
And if you're conscientious about the environment, let's say you don't want to throw out plastic rings every couple of weeks, then that's something that might be important to you.
And one day, if hopefully not, but just talk about one day you might need a pessary.
That's what I thought it was at first. Honestly, I thought it was a pessary, which is like what we use for when
this is a much nicer
your
version.
bladder's like falling out of your body and you shove it in. Sorry, I digress. So there's some other things we can really, really quickly cover before we actually get to like the more fun stuff of this episode, as if you're not already having so much fun. We have injectable hormones for birth control commonly called the Depo-Provera injection. That's a one-shot deal, literally an injection, lasts for about 3 months, but there are some exclusions.
You can only do max for 2 years. Because after 2 years, then it's associated with bone loss, and that's the one that also has a significant change in weight gain.
Yeah.
And a lot of them actually with obesity in itself have like certain contraindications. So again, specific ones, talk to your providers, but that's technically an option, but it's not a long-term option.
Yeah. Now they have, we know the stuff that's over the counter. You have your condoms, you have your spermicide, you have your withdrawal method.
You also have a pill now.
For men.
for women.
What do you mean for women? What are you
There's
talking
a
about?
progesterone-only pill that has now come out that is over the counter
Stop
in
it.
the United States.
Wow, that's cute.
But then if you, like me, and just go to Mexico on vacation once and you go to the pharmacy there, you got
all of it.
all of them here. You got oxycodone here.
Why would you take a progesterone-only pill, though?
Well, for the same ideas of like you can't have estrogen, right? So let's say you are a heavy smoker for whatever reason, or let's say you have liver disease. There's many other things, or you had a history of a blood clot. Those are big things. So there are reasons where you would focus on being just progesterone only versus having estrogen. And don't forget, this ring, estrogen also. This has estrogen in there. So again, nuances, talk to your providers so they could give you the best options for your care, which is super important.
All right, so give us a second. We're gonna be right back after we refresh our drinks, and we're gonna talk about some common myths about birth control. And listen, you need to know these because we all know that you can barely keep a plant alive. You don't wanna be trying to mess around with a baby.
Facts. See you soon.